Good afternoon, everybody, and thank you to the Tysons Chamber members as well as the guests who are joining us. I appreciate having the chance to be here with you today to discuss the post-COVID-19 workplace reopening plans, perils, and plans to avoid those pitfalls. Now, before we discuss how to open, preparing to open, I want to discuss if you should even open. I've had this conversation with a couple of my clients, and as I prepare to discuss how, I want you to look at this statistic. The total United States military fatalities during the Vietnam conflict were 58,220. As of yesterday, according to the CDC, we have lost 110,375 Americans to COVID-19 deaths. They are fast approaching twice as many as we lost in the entire Vietnam conflict. And I want to tell you, this is the third time that I have delivered a webinar about the post-COVID workplace and returning to work. I keep updating this statistic. The first time I delivered this webinar was May 13th. From May 13th to today, we have added 29,555 more deaths. I keep going back to the CDC website and I keep updating this. Now, 29,555 sounds like a lot, but let me put it in perspective this way. It's about like if we took the entire student body of Virginia Tech and they were all deceased in a month. That's a pretty scary way to put this. So if you're thinking about bringing people back to work, there may be good reasons to do it, and we're going to explore that in a moment. But I want you to have a clear vision in your mind of this. Are you doing it because you just want everybody back in the workplace like they've always been? Or do you have a business justification for it? Because we, as good business people, are also good risk managers. And choosing to reopen your work site involves managing risk in a way we've never had to do before. These numbers are kind of a little bit concerning, I would say, but let me just add this to you. Back in early May, New York Times reported that the CDC said, once reopening has begun, there will be another 100,000 more deaths expected by early August. This was in early May, right about the time I did my first return to work webinar. About 30,000 people, we're about a third of the way there. And it's only early June. We're not yet at early August. I leave you with the data to think about what you will do with it, my friends. It is your business, and therefore it is your decision where your people will perform their work. You have that right. There's nothing wrong with exercising that right. But as you consider it, I want you to do so thoughtfully and with the right business justifications in mind. You're not going to be able to say, well, the president or the governor or the mayor said it was okay to reopen, so I reopened, and use that as a justification for dealing with your employees who may be disgruntled about the fact that they have to come back to work. Or what if somebody gets sick? Or what if you have employee relations issues because there are children to be dealt with, or people who have compromised immune systems? You have the right, but you must exercise it wisely and communicate appropriately with good business rationale. Now, one of the parts of the title of this session is about how to get past the perils and get over the pitfalls. And I'm going to take you back in time with me. We're going back to 1982, because when I was a kid, and yes, I know I'm dating myself, some of you may recognize this. It's an old video game that we used to play on the Atari home game system. And back in that game Pitfall, there was this fellow named Pitfall Harry. Now I know you're looking at that right now and you're thinking, wow, what fabulous graphics they had right now, right? That's exactly what you're thinking. I know it, right? Fabulous graphics. But here's what I had to do when I was Pitfall Harry. The risks that I faced, to put it in appropriate business language, were crocs, logs, rolling down the hill at me, scorpions, all those kind of things. You can see that here on the screen on the old cover. Now, what were the rewards that came with approaching and surmounting these risks? There was gold. There was silver. There was money. Okay, great. Now let's talk about you in 2020. You still have risks, but instead of Crocs, you're facing Corona. Instead of logs, you're facing laws. And you don't worry about scorpions, you worry about having enough sanitizer. And what are the rewards that come from dealing with these risks, my friends? Well, you may not get any gold, but what you are going to get is your goals achieved. Some of you are still trying to improve your market share, or you are trying to raise your net promoter scores. Bravo, soldier on. You're not going to get silver, you're going to get survival. At this point, if we could just make it through this, for many of us, we will call that success. And you're not going to get money. Actually, yes, you are going to get money because this is business, and let's just call a spade, right? There's nothing wrong with money. There's nothing wrong with profit. It's not a dirty word. That's why we go into business, and that's why we run our businesses effectively. But I need you to think about the risks you face and how they will impact your ability to get to those rewards. And as I think about them right about now, I'm thinking it might have been easier dealing with the Crocs and the logs and the scorpions trying to get the gold. But be that as it may, here we go. You, my friends, as you think about your reopening planning, you need to realize that you will be at the intersection of many issues. The first issue that you need to think about is your workforce. I'm thinking about the type of workforce. Do you have a white collar or a blue collar workforce? Are they all co-located in a particular site, or are they out in the field visiting customer homes? How big is that workforce? Because of course, the bigger they are, the more opportunity there is for interaction and the more opportunity there is for exposure. Also consider the demographics of your workforce, the average age. One of the things that we know is that older folks are at greater risk of contracting the virus than younger folks. So what's the average age of your workforce? And as you're considering the demographics, think about the number of your staff members who have families, specifically those with young kids who require some child care. In fact, I can even take it the other way. Think about the sandwich generation. That's a term some of you may know, but in quick definition, it is those people who are sandwiched between their responsibilities as parents taking care of their kids and the responsibilities as kids who are taking care of their own parents. So if you've got somebody who's worried about maybe kids that are still at home and elderly parents who are, again, in the high risk group for the disease, all of these things should be taken into account as you decide, is reopening the right move for me? And if it is, am I prepared to make individualized decisions for those people who are more affected by the virus than others? This is not one size fits all. This is not send out an email to the staff on Friday, say everybody come back to work Monday. If you think it is, I'm glad you came to this webinar. Hope some light bulbs go on for you. Because my goal in our brief hour that we have together is to try to make you aware of all the risks that you face and how to communicate and deal with them effectively. But let's look at some other things that you're at the intersection of, one of which is culture. Is your organization very democratic in its decision-making approach? Have your work styles perhaps been hindered because of the geographic separation of everybody being at home? If so, then I understand that those are drivers around getting back to work. But that demographic decision-making is important to know, because maybe you need to be communicating with your team saying, I'm thinking about coming back to work, gang. What do we need to factor? What do you need? What do you want to see? What do you want us to do to make sure you're comfortable? Now, this is business, and so we got to talk about economics. How is telework, or being closed, either in full or in part, been impacting your finances? The question I have for you is, can you continue to stay in business with your workforce largely geographically dispersed? Because if the answer is no, well, then I can certainly see your justification for getting everybody back to the office. But again, the way you bring them back and the planning for bringing them back is going to be critical, because of the justification may be there, the execution could be where you fail. So when you think about that, remember I said one of your goals was survival, right? Not silver for Pitfall Harry, but survival for you. If the economics say we need to get back in the office, that's fine, but think carefully about how you make it happen. And last, again, we talked about risks, and one of the risks that you face is the law. There are a lot of laws out there. Some of them are not new. They are just being approached differently through the light of a global pandemic. First of all, the Occupational Safety and Health Administration, or OSHA. It's been around for years and years. We know as employers that we have a duty, and our duty under what is actually called the General Duty Clause, it's right there in the document, in the law, is to provide a workplace that is free from recognized harms, right? We need to know what dangers exist in our workplace and do all that we can to eliminate them. And that happens in a lot of different ways. You could be working with chemicals. You could be working with sharp blades. And how do we deal with that? Or we put guards on the blades, right? Or we give people gloves and masks and goggles. Doesn't that sound familiar right now? To protect them when they're using chemicals. Nothing new now in the era of COVID-19. It is still your job to provide whatever kind of protections and mitigation measures are available to maximize the safety of your workplace, okay? Now, that's not the only law. Oh no, there's a lot more. The Americans with Disabilities Act, been around since 1990. I don't know if there's many HR people on the call today. I think it's mostly business professionals, but because this law is, you know, like 30 years old, I hope you've heard of it. And here's where I'm going with this. You have an obligation. Of course, I'm speaking in general terms because I don't know anybody who's on the call today. But you have an obligation to work with somebody who has a disability to determine if there's a way to enable them to perform the essential functions of their job, even with the disability. And many times there is. But now we've got the coronavirus. What are the disabilities that are more affected by this virus? And how can we potentially find a way around those disabilities and the risks associated with them? One of the common answers is somebody has an immune system that is compromised. It's a pretty good chance they might be considered disabled. And one of the common ways to accommodate that disability is say, stay home, telework. So if you're preparing to bring back your entire workforce, realize that there may be some people who have some sort of medical condition that justifies them continuing to telework. There's also some other laws still out there. We're not done yet. For example, pregnancy, right? Pregnancy Discrimination Act. And I'm talking federal, but there are also state laws out there. If somebody is pregnant, I guarantee you they have a much heightened level of concern about being exposed to the virus than a non-pregnant person would. How are we going to accommodate that? Now, the good news is pregnancy only lasts 9 months. So sooner or later it ends. But at some point, if you have a pregnant colleague, how are you going to deal with them? Factor this into your planning. But wait, we're not done yet. Because the big law that was passed that impacts our operations, that was passed by the federal government, was the Families First Coronavirus Response Act, or FFCRA. And that created a variety of brand new obligations for many of us that we never had before. One of which, for organizations under 500 employees, is your obligation to provide paid sick leave in certain circumstances, up to 2 weeks of paid sick leave. So if you're bringing everybody back to the office, there may be a greater likelihood that they will get sick with the virus. And then if they get sick with the virus, you must give them 2 weeks off with pay. 5 work days, 10 days total. There you go, okay? 2 work weeks. And you have to pay it. Now you are able to get a tax credit to offset the cost of that sick pay that you paid to that person. But nonetheless, you would have to give them that sick pay. Now let's talk about kids. A lot of kids are not in school, not in daycare, not in child care camps or anything like that. Why? Because it all got canceled, which means they're all home with your employees who are also parents. Now I'm a parent and I'm a business owner and I'm an HR guy. And I will tell you, among all that, I usually would tell you, you had the kids, not me. It's your responsibility to find a way to take care of them. And generally speaking, that's a reasonable statement. Certainly you want to work with your people, right? And certainly things come up. But here's something that's never come up before. Everybody's out of school. Everybody's out of camp. Everybody's out of daycare. We've never had that happen before. So are you going to tell me that just because you're the business owner or the business leader and you get to decide that you're going to tell everybody to come back? Because I'm going to tell you, what do you think they're doing with their kids? Forget your business plan. Let's just get practical, right? We're business owners, we're business leaders. We have to be practical. What's going to happen to those children? I'm lucky. I have teenagers. They don't need me. They can feed themselves, bathe themselves. They watch YouTube. They watch Netflix. They don't need dear old dad to take care of them. But if my kids were not teenagers, if they were 7, what do you think I'm going to do? Leave them in the house all day by themselves and just go to work? You need to think about this, because the way you deal with these things can either reinforce the trust and the relationship that you have with your staff, or it can seriously undermine it. You can erode that trust that you work so hard to build. That's not good business. And that's the way I'm approaching this. So things to think about. You also may want to think about, final comment on law and risk, PPP loans, right? Some of you may have gotten those. I know I did. I have clients who did. I have colleagues, friends who did as well. And we've talked about how those work and what that means for their operation. Well, the good news is Congress just signed and passed and the president signed an adjustment to the law. You used to have to spend 75% of your PPP money on payroll. They lowered that to 60%. And you used to have to spend the money within 8 weeks of getting it. They extended it to 24 weeks. So if some of your desire to get back to the workplace was because you're concerned about how you were using the PPP money, just recognize that the government has reduced some of your stress, right? They have lengthened the period of time and they've lowered the threshold, so that might decrease your need for returning to the workplace. And remember, I want you to manage your risk and I want you to do it well informed. And so now you got some hopefully helpful new information. So as you look at this intersection of all these issues, it's like dealing with a massive beltway traffic jam. And I want you to think about all of it before you decide to reopen. But if you do decide to reopen, our friends at the CDC have created a number of different flowcharts to help you plan your reopening. Some of them are specific. For example, they've developed one specific to restaurants. This one is generic. It is just for workplaces. So I know it's kind of small. You may not be able to read it. You're not really meant to read it. I just wanted you to see it because you can go to the CDC website. This is your government taxpayer dollars at work here. You can go see these different posters that they have for you to hang up, these flow charts that they have for you to utilize, and you can download them and share them as appropriate. So please, this is another tool. It's available to you. Take advantage of it. Now we know that the government has been looking at reopening in phases. And so I feel like you can use the same idea of a phased approach as you think about your reopening and planning for those perils and those pitfalls, right? So we're going to run through these phases in the following slides. We've got a couple of pre-return phases. What do you think about before you open? Again, I'm trying to give you concrete, valuable things to think about and use, share with your other leaders, or utilize yourself depending on the decision-making authority in your organization. And then congratulations, you're finally open for business. What does that look like? What do you need to do while you are reopened? And then how do you manage risk and pivot in this new work world? So let's break these down in the following slides. Phase 1, here we go, pre-return. Let's talk about your office cleaners. They haven't been cleaning your office because you weren't in it. But now you know what? You want them to clean it again. And you don't just want them to clean it like you used to. You want them to clean more items more frequently, right? Instead of coming to your office twice a day, emptying the trash can, whatever, now we want them cleaning all the door handles and everything anybody touches. You better hit it with the disinfectant, right? So before you talk to your staff, call your office cleaners. And if the office cleaners are provided by building management, so be it, because you need to talk to building management anyway, because maybe the building is not ready for you to come back. I was speaking to one of my clients who told me he went into the office the other day by himself and all the HVAC was off. Now it's getting hot out there. This is Virginia in the summertime, right? So you better be talking to your business, your building manager saying, okay, I want to bring my staff back. When's the building going to be open? And then if, again, if they maintain the relationship with the office cleaners, be sure that you're having that dialogue with them. Now, taking it the next step, getting a little bit more granular, talking about your particular workspace, what kind of physical changes have you made or will you make? You know, a lot of companies went to this idea of an open cube area, right? A bullpen, all these desks together, right? Everybody can collaborate. It's energetic. It's great. Until everybody is worried about catching diseases for one another. And now all of a sudden I'm longing for the good old days when I had my own office, I could close the door and keep the germs out. So what are you gonna do? I got a buddy of mine who's in my network who works in a handyman company. Okay, he's the business development guy. He says, Adam, we've been doing a ton of corporate work lately because companies have been asking us to come in and put up all these plexiglass guards, separating colleagues from one another by their desks, separating receptionists from visitors. You better find somebody to do that. Otherwise, you're going to Home Depot, you're buying plexiglass, you're trying to manufacture it, hang it, whatever. Who's doing that in your company? Are you going to go to HR and say, congratulations, you're now in charge of plexiglass? Then maybe you can, but I mean, seriously, where are you getting the plexiglass? How are you putting it up? Those kinds of physical barriers at a minimum are what people are expecting, because every one of us, as we have been going out, and even the minimal going out that we're doing, you know, you go to the grocery store and there's a barrier between you and the checkout clerk. So you darn well bet I expect the same kind of thing in my office, which means you need that pre-planning to find somebody to come out, measure where we putting them, how many we're putting them. That takes time. It also takes money. I have no idea how much that stuff costs, but your budget needs to now allow for it. And if your budget doesn't allow for it, you better think of what's your alternative. Of course, PPE, right? Hey, this is like the 3 most used letters since March. PPE, right? Personal protective equipment. Don't ask me to come back to your place without gloves, cleaning gear, and masks. Now, sure, maybe I can provide some of my own stuff, but again, is that going to be your message to your team, that they must provide their own PPE? It could be. I don't know how you feel about that. Employees are going to be like, what? I have to provide my own? You're not protecting me? I don't know your staff. I don't know your culture. I just want you to reflect on it so that you make effective decisions. But at some minimum level, you need to have the PPE available. I will tell you, Clorox wipes and Lysol, the company that manufactures them, it's called Rickett Benckiser, have upped their production by 40%, and they still cannot keep up with demand, which is kind of an interesting silver lining, right? In the middle of a global pandemic, they're making big bucks on selling Lysol, right? I guess there's always that for somebody. So if you're going to say you're going to have this stuff available to your team, you better have it, and you better know where to get it. Another thing that you've probably noticed in the grocery stores is they've got these maps painted on the floor or taped on the floor, whatever, right? Go this way, go that way, because they're trying to avoid people being too close together. I have no idea what your workplace looks like, but I'm going to encourage you to think about the same thing. Can you literally map out your workplace and say, all right, this is the way traffic flow will be until further notice? Put up the signs, put up the one-way signs, right? Tape on the floor, and explain to your people, we want you to follow these rules, and we want you to acknowledge that we've put these things in place because we are here to keep you safe and healthy. Because number one, if they're healthy and safe, they can come back and do the job that you need done. Number two, you're lessening the likelihood of any sort of illnesses being spread or of any legal action being taken against you. And in the end, in the event that there are any illnesses or legal action, hopefully the illnesses spread less, and the better defense you might have against any liability they might try to impose on you, because you'll say, hey, yo, jury, your honor, listen, we did all these things. These are the things that I believe a reasonable person is going to expect to see. So make sure you're ready. Of course, I want you to think about your public areas, right? Your kitchen. Forget that. Close that thing. Nobody's using the refrigerator. Nobody's using the microwave. You better bring your own lunch from home, bring a sandwich bag, right? Bring a little, cooler, right? Why? Because I don't want your food next to my food. Who knows how sick you are, I am, who's been exposed, right? A lot of people are asymptomatic right now. You may think you're fine. I think I'm fine right now as I'm doing this webinar. Maybe I've got the coronavirus. Knock on wood, hopefully I don't. I'm going away next week, but I want to close those public areas as one more way of saying we are limiting the likelihood of exposure, right? Obviously, you can't close the bathroom. I understand that. But break rooms, if you don't close them, you can certainly lessen the number of people that can be in them. You can spread them out, social distancing. Conference rooms, again, you might say, even though we're all back in the same physical space, we will continue to do our conference calls because this way we're not all packed in person by person by person next to one another, sitting in a 10 square feet conference room. We're all breathing each other's air. Again, one more way of showing your staff you're looking out for them, and it's a way to send the message that we care, and we want to still be careful of our customers as well. Let's talk about surveys. Now, I say this is a time to not collaborate, to collaborate, but not dictate. Again, ask your team, what do you need? What do you want? What are your concerns? If we come back to work, what are the challenges you're going to face? Some people are going to say, hey, I have elderly parents who live with me. I don't want to go out because I'm worried about bringing a disease home and exposing them to it. How do you know that? Well, if you have a small staff, maybe you know your team well, you might know this is a concern for Juanita. This is a concern for Jesse. Got it. But maybe you don't know those things if you have a busy office with a big staff and a lot of turnover and those kinds of things. So this is a time to collaborate, not dictate. Survey them, talk to them, find out so that you can build it into your planning. As I said, this is not the first webinar I've done on returning to work. I think this is now like the, 7th corona-related webinar I've done. And since the beginning, I've been saying this is a time for flexibility, creativity, and adaptability. You got to do things on an individual basis. Also, as a good HR guy, I'm going to encourage you to give written communications to your people. I love Zoom. I love conference calls. It's all great. But I want you to be able to put some things in writing so that you can prove if anything ever happens later, here's what we told them. We told them they must do this. They must not do that. We told them bring this and we will supply that. We told them these areas are closed. We told them this is the new traffic. And we had them sign an acknowledgement of the new rule changes. This is nothing new. You've been giving out handbooks for decades now. What happens when you give out a handbook or a new handbook? The person signs acknowledging it. Recommendation, sign that they acknowledge the new rules that you're communicating. Now again, still do it in person, of course, being via video conference, but put it in writing. It's also a time to think about training, right? We need to give some training regarding the space, the cleaning, but I also want you to think specifically about your managers. Employees look to their managers as leaders to give guidance and direction. Your managers have never had to manage in a global pandemic before. They need to say the right things you want them to say. They need to do the things you want them to do. They will only know that stuff if you train them. So again, it's a time for some written communication to your management team in particular. And it's a time for some Zooms and corporate conference calls with your managers in particular, and have them get a little follow-up, a little one-on-one, whatever it takes, so that they know, because they need to do it as a role model, and they need to make sure that their team members are following the rules that are meant to keep them and our customers safe. Think about things that you might do, again, in the way of policies, like, are you going to have staggered work days? Are you going to have staggered work times? Are you going to have equipment that you used to share among a group, and now it's going to be individually issued so that there's no sharing and there's no opportunity to be touching and, of course, sharing germs along with sharing equipment? How are you making changes, even if they're only temporary, for the duration of the virus? Think about it. I mentioned this earlier as a legal risk. It is worth mentioning it again here. There are accommodations that you may need to make. I'm not saying you will need to make because everything is different. Everything is individualized. But I'm strongly making you aware of the fact that you may need to make accommodations on an individualized basis based on somebody's needs from a medical point of view or from a family relationship point of view. And again, some of these things would have not come up back 3 months BC. When I say BC, I mean before Corona, by the way. I stole that from someone else. Feel free to laugh. Again, scheduling. Who's coming back when? How are you making these individual decisions? How are you saying telework will be different after most of the team is back in the office? How will we continue to involve those few who remain geographically dispersed? Lots for you to think about, and that's what we're here for today. Now, congratulations, you have reached phase 3. Come on in, we're open for business. I love it, but how are you going to maintain everybody's safety? Are you taking temperatures? Are you giving them a daily questionnaire? You know, have you had this symptom? Have you had this symptom? Have you been in touch with anybody who has had these symptoms? Do you live with anybody who's had these symptoms? Have you traveled to blah, blah, blah places? How will you ensure the continued safety of your people? That's the question. Again, one of the things I would recommend is going back to that flow chart from the CDC that I showed you earlier. Also remember that just because your people are back in the office does not change your continued obligation to maintain responsibility under the FFCRA, the Families First Coronavirus Response Act. Again, that is for paid sick time or for paid extended family leave for parents who need to be home with kids. This law, it remains in effect until December 31st of 2020. At least that's the way it was originally written. Whether they change it, we'll see how the remainder of the year goes. But you may find yourself having to give time off under the different aspects of that law. And my question is, now those people are off. They're not doing anything. Would it have not been better to let them continue to telework? I don't know. It's a business decision. That's why we're laying all this out in those terms. Process and procedure changes, right? How are you limiting your visitors? Maybe visitors aren't really an issue in your workplace. Fine. But for some of you, it may be. Are you putting up the right signage? Are you scheduling, right? Maybe instead of 10 different salespeople just scheduling people to come in the office and meet with them, now we need a global shared calendar. Why? Because you get a guest at 1 o'clock, I get a guest at 2 o'clock, she gets a guest at 3 o'clock, so that we don't overdo it with traffic coming through here. Deliveries, vendors, think about it. Business travel. Is anybody traveling for business? If they are, how are you defining who? How are you managing the risk while they're away? And by the way, what if there's a next wave? I'm not a doctor, folks. I'm an HR guy. I'm a business owner. I'm definitely not a doctor. But I've read some things that do say there's a chance we'll have a second wave. So what are you going to do now while everybody is back in your office to prepare for the potential second wave? Because think of what happened back in March, right? This blew up. None of us were ready for anything. None of us, it just came out of the blue. But now we can think about what we had to do on the fly and think, okay, how will I make sure I'm ready, right? Is my new policy going to be, yes, we're open. Yes, you're coming back to the office, but you must continue to take your laptop home every night. Why? Because if we need to go quickly back into COVID hunker down mode, you will be equipped. By the way, there was this great bit on Saturday Night Live. They did this funny skit, it's like a month ago now, about people who couldn't manage to get on a Zoom call, right? Of course, you're all on a Zoom call, so it's kind of funny, but you know, this one here can't turn on the video. This one can't operate the audio. This one takes the camera into the bathroom with her, right? It's like, oh, geez, right? You know? Are there some people on your team, now that you're all back together, who you want to issue some training to so that they will be prepared, right? Do you have some technology issues that you couldn't really address? Because again, everything happened quickly, that maybe you're now taking this opportunity to prepare for that second wave. Digital signing accounts, right? If people have to sign stuff over Adobe Sign or DocuSign, Well, hey, walking down the hall and getting the boss to sign a PO is no big deal. Now you're all geographically dispersed. Did you have enough of what you need? Can you get it and train it while you're all back? And again, you may have a variety of other regular policies. Do you need to tweak them? For example, I'm sure you have some kind of policy about paid time off, sick time, vacation, whatever it is. And many of you probably address carryover of time off. Well, nobody's going on vacation right now for the most part, so they're not using their PTO. Now, some people probably need to take some mental health days sometimes right now. Just go out in your backyard. Don't work on your computer, right? Get some sunshine, go for a walk. But you're not seeing big family vacations, extended family vacations like you would typically see. So what's going to happen at the end of the year? Are all these people going to have a bunch of vacation hanging? Think about your carryover plan. It may need to be different, at least for this year. Now, you're coming back to the office. That's great. Just because you're back in your normal workplace, does that mean work will be normal? Are you going to be marketing differently? I got news for you. Right now, it's about survival. Maybe there are clients that you would have turned down before. You'll be happy to have them now because any revenue is better than no revenue. And a little bit of profit is better than no profit, especially when the alternative is what? Bankruptcy. And remember, if you're doing any work, you can use that PPP loan money to pay the staff to do the work and use up to 40% of the rest of that PPP money towards things like rent, utilities, etc. Right? So is your marketing going to be different? Are you going to be selling new products and services? I know one guy who does 3D printing. How much money do you think he's making now making those 3D protective masks, those printed masks out of plexiglass? He never did that before. He's doing it now. New locations, new customers, new pricing, new hours. Remember we talked about staggering, arriving, and departure time of your team? Are you going to have new hours? Be prepared to pivot. This is the time to adapt. You got to do what you got to do to survive. You got to make it to the other side of this. And your team needs to know what role they play. Now I'm going to give you the excellent example of pivoting. I'm sure most of you have heard of a little old tiny company called Walt Disney. And I'm sure you recognize Snow White and the Seven Dwarfs. I'm going to take you back in time with me to World War II. The Walt Disney World Studios, who at that time had been known for fabulous animated classics, Disney and Mickey Mouse, Snow White. What was their new business? Creating training and propaganda films for the United States government and military, and also incidentally for Canada. Their art department was designing logos for ships and military units. I got news for you. If Donald Duck told me to enlist and go out and fight the Axis powers, by golly, I was gonna go, because me and Donald, we're fired up, we're ready to go, right? All kidding aside. Totally different than anything they had done, but they used their skills to deliver to a new customer. Your people need to recognize that you need to do what you need to do so that they remain employed and you stay in business. How are you going to pivot? They need to be prepared so that when they come back to the office, they are on board and ready to go so we can ensure your success and survival. Now we're back in business, right? Risk management, just in case. What if a staff member gets sick? Do you have the right mechanisms in place for tracking their contacts? Who'd they go? Where'd they go? Who'd they go in contact with? How will you respond better than last time and faster than last time if there's a second wave? We discussed that earlier. Now, I don't know how many of you might have hired any people while you were remote. But believe it or not, that little old I-9 form, it's been around since like 1986. We have to do that to prove people have the right to work in the United States and prove their identity. Well, you couldn't do what you'd always done because you were hiring them remotely. And what do I mean by doing what you always done? You're supposed to look at their identification, driver's licenses, passports, social security cards, all those kinds of things. You have to look at them in person and you fill out the I-9 as the employer. You could not do that when everybody was working from home. So fortunately, the Department of Homeland Security gave us a little bit of flexibility here. They said, hey, listen, some documents are going to expire. because people can't go to the DMV and get a new one, or they can't go to the post office and get a new one. So we're going to give you a little flexibility there. And oh, by the way, you can't review stuff in person right now. So the new rule is look at it over the camera, right? Like we're looking at each other on camera now. Or take a picture of it, email me the picture, scan it, email me the scan. Those things are temporarily allowed. Please note my emphasis on the word temporary, because they say once you come back to work and you resume your normal operations, then the old rule takes effect again. You have 3 business days from the time they start to review their documents in person and fill out the form the proper way. Now, I'm not here to teach you how to fill out the I-9 form. That is not the focus. But I want you to understand that if you get everybody back in work, those new hires that you made while you were apart, you better have them bring their ID, because you got 3 days from the time you're back in the office to review it and complete the I-9 appropriately. I don't know how many of you have employees in the District of Columbia, but there's a new law that was passed last year. Last July, the district started collecting taxes to fund the Paid Family Leave Act, which takes effect July 1st. Gee, that seemed so far away back in March, but now we're deep into June. Doesn't seem so far away. As of the 1st of July, your DC employees are eligible for 2 weeks of personal medical leave, 6 weeks of family leave to care for a sick family member. This is paid by the district. It is not paid by you. There's a link I gave you here to a very nice FAQ. You'll see I put the FAQ here on the screen for you. I know you can't read that. I just want you to know it exists. It's not meant for you to read. Go there. If you have employees in the district, you need to know how this might intersect. Now, maybe I've heard some talk that they might delay the effective date of this. But I'm not a lawyer and I don't work for the DC government, so I can't tell you. My job as your webinar presenter is to make you aware so that you're prepared. Now, I want you to know this is not the first time I've talked about this. I've been on the radio in Houston, Texas, Columbus, Miami, all over the place, satellite radio, TV in Tennessee. I want you to know there are a lot of resources out there. I gave you the links to other places I have been. If you check out my website, you'll see a whole lot more. This has been a very big issue for the media. And I've been fortunate that I've been a source for TV, radio, web, satellite, etc., and print. Please go check out these resources. They'll give you a little bit more help. Now, at this point, I promised Barry that I would allow time for questions in our last 15 minutes. And by my clock, I've given you 13 minutes. So I'm sorry I'm 120 seconds late there, Barry. Hopefully you'll forgive me.
Adam, thank you so much. That was a lot to think about, and questions coming from questions of questions. So I haven't received any questions in our chat, but want to open up the opportunity for people to please pose a few questions to our expert here. A lot of good takeaways.
At your disposal. This is free consulting here. People usually pay a lot of money for this. You get it for free today.
For the next 12 minutes.
Next 12 minutes, absolutely. As I wait for the questions to come in, I will tell you that I have a client who is really eager to get his people back in the office, which I understand. And one of the concerns that his number 2 raised to me was the fact that they have admin staff and they have field staff. And the field staff have to be in the field. They have to go to client sites because that's how they do their job. I mean, they could do some phone calls and some emails, of course, everybody can. But the basic job is to go to the client site and do the things that they're tasked to do, okay? Meanwhile, the admin people, they're just in the office. Everybody's been teleworking right now. Well, the concern that the number 2 has is, well, the boss wants everybody back. He doesn't care that admin people can work remotely. He thinks we need to be fair. Now, as an HR guy, I'm usually on board with the idea of fairness, but fair does not mean equal. You are in the field. Your job requires you to be in the field. You cannot not be in the field and do your job. Admin people can do their job and do it remotely. So I said, no, there's no justification for bringing everybody back just because you want this idea of fairness and equality. So think about that. Different solutions for different segments of your workforce can be appropriate as long as you're consistent within the group and as long as there are non-discriminatory, easily justified, business justified reasons for the difference. So another bit of something to think
Good
about.
example. And actually, Bob Hall had a question about how many, whoops, now we're getting a couple here, so let me scroll back up. So Bob's question was, how many lawsuits do you expect from around the country about these employment issues?
Oh, well, I have some buddies who are employment attorneys, and they all expect to make a whole lot of money from this. Let me put it to you this way, Bob and everybody else. They called it a tidal wave of litigation. Now, I'm going to tell you, some of those lawsuits are going to be frivolous. Nobody's going to win everything, right? But the fact of the matter is there's going to be a lot of them. And the more things that we can do proactively, the less likely there will be a lawsuit against you. And if there is a lawsuit against you, the greater the likelihood that you'll either be able to settle for a very small amount of money or win. I want you, of course, to avoid the lawsuit entirely. But if the plaintiff's attorney tries to raise an issue to you and you say, whoa, we put in shields, we had staggered work schedules, we had, work days limited in the office, we had, and I have an acknowledgement, written, signed acknowledgement that your person knew all the rules and everything we had done and never asked for any kind of accommodation, that lawsuit might go away. But it's all about you being proactive there, Bob. What you got next for me, Barry?
Okay, Jared has a question. Should you consider restricted business operations rather than blindly following reopening phases if you can financially afford to do so?
Absolutely. You make your decisions for your business. If the president, the governor, and the mayor say you're allowed to open, that's great. It doesn't mean you have to open. You make the decision that's right for your business. And of course, as I said at the beginning, we're looking at the economics, the legal, the cultural, right? All those things I showed you in that little graphic of the highway intersection. So absolutely, you do what you feel is right. You also do what you feel is affordable because I want you to survive, right? I want you to make it through this.
Excellent, thank you. And Jared also asked another question. Should we consider temporarily changing internal department review processes due to impact on category criteria such as sales production?
I think that's a very reasonable statement, yes. Of course, exactly how you change it is going to depend on the job and the responsibilities. You mentioned sales, so that's a kind of an easy example because, of course, if you're in sales, you exist for one reason, sell. And if you have a sales job, chances are you have a quota. Nothing wrong with that. I love all that stuff. But what does your quota look like in the era of COVID-19? Is it as easy to get out and sell the way you used to, right? I mean, I go to networking events all the time, right? That's how I get business. Well, all my networking events were canceled for a while, and now they're all being executed over Zoom, which is fine because at least it's still networking, but it's not the same. But networking is not exactly sales, right? I mean, I'm not calling on these people saying, you want to buy 100 widgets, right? So I think you're being very reasonable. I also think, because I'm in HR, I'm a big fan of putting things in writing. Make sure you put in writing that the adjustments you made to people's obligations, or i.e. quotas, were made because of the coronavirus, right? Because here's the thing, next year, no coronavirus. Your goal is your goal, I expect you to hit it. But this year, I'm a reasonable guy. I'm not trying to tell you you still have to sell 100 widgets a month when people won't even open the door to meet you. So, good question. Thank you for asking.
Lisa has a question for you. What if a company decides to make remote work permanent? How does this affect I-9 requirements?
Well, hi, Lisa. You've been with me before, so it's nice to see you again, virtually, so to speak. Okay, this is not an I-9 class, so I'm going to give you the quick answer. It has always been the rule, that you must review the documentation in person. Okay, and when I say documentation, I'm talking about the ID that proves the person's identity and their right to work in the United States. Now, over the last 20 years or so, we have had more and more people working remotely, and companies grow, and now you have a new office, and there's no HR person in that office. So the official rule says a designated representative of the company can review the I-9. That designated representative does not even have to be an employee of the company. You could get a notary to do it. You could get a lawyer to do it. And I don't want you to think of this as an official endorsement, but there are companies out there and their business is reviewing I-9s and I-9 documentation for remote employees for companies who are elsewhere. One of those companies is called N3 Notary. The letter N is in November. The number 3 is in, trace, comes after 2 and before 4. N3 Notary. Now, if you just look them up and Google it, you'll find there are other firms out there. The last time I checked, it cost about 65 bucks. So it's just going to be a new cost. But so what? You're not paying for rent and office supplies and coffee. You saved a heck of a lot of money. That's your solution. You'll still come out way ahead, and you're legally compliant. And Lisa, since we know each other, you can reach out to me if you want to chat.
Great, thank you. We have a few more minutes. If there are any other questions, please put them in the chat group. And also just a quick reminder, if you would like a copy of today's presentation, the video recording, please email info@tysonschamber.org and we will get one out to you as soon as they're available. It usually takes us a day or so. Well, it looks like, let's see, looks like we are all ready to go. I don't see any other questions. If you like to just thank you, Adam. That was really helpful, very relevant, very timely. And we hope to see many of you here at one of our next programs. Thank you again, and everyone have a great afternoon.
Bye-bye.
Bye-bye.
Take care. Good luck. Stay safe.